Good day, dear colleagues. The topic of presentation is Organizational and Pedagogical Conditions of ICT Health-Saving Usage at School. At the present stage of the society development, information and communication technologies have become an integral part of human life, including education. The use of ICT in educational activities has numerous advantages. Along with these, students' work with ICT is associated with increased mental, nervous, emotional, and visual load. This is especially true for middle school students, teenagers who experience complex process of physical and psychic formation. In the last years, the health of teenage children demonstrates a negative tendency to worsen. According to the Ukrainian law, the schools should create the optimal conditions for maintaining and promoting the students' health. Therefore, it is important for teachers to be competent in creating the right learning conditions and designing a health-friendly education environment. An important basis for the health-saving use of ICT in the educational process is compliance with appropriate organizational and pedagogical conditions. As a rule, the elements of organizational and pedagogical conditions include material and technical base, forms, methods, aids, technologies of the pedagogical activity, conceptual theories and principles of the organization of training, the professionalism of educators, artificially creating and objectively formed pedagogical situations, etc. We have identified a range of organizational and pedagogical conditions for the health-saving use of ICT at school, as you can see on the picture. To our opinion, the health-saving use of ICT should be considered within the digital competence as one of its components. Formation of the health-saving component of students' digital competence involves the formation of a set of relevant knowledge, skills, attitudes, beliefs, motivations aimed at maintaining physical and mental well-being and health. We believe that this is the basis for ensuring the safe use of ICT. The formation of students' ability to use ICT safety should occur systematically and consistently not only during the study of computer science, but also other subjects, biology, informatics, physics, physical culture, etc., as well as in the form of messages and discussions during electives, thematic classes, etc. Compliance with the sanitary and hygiene requirements for the arrangement and equipment of computer training rooms minimize the potential negative impact on the body of the younger generation. Next, the adaptive workplace of the student should match his/her age posture. Besides, adaptability implies that individual components of the workplace can be adapted depending on the individual characteristics and needs of the student, age, vision, etc. Next, in our case, the quality of ICT is determined by its safety or for the consumer's health, lower radiation, better image quality, ergonomics, etc. Obviously, a modern LCD will have less of a negative impact on the user. Therefore, we consider such ICT better in terms of health saving. The effectiveness of the learning environment depends also on how pedagogically balanced the ICT tools are applied. When planning a lesson, the teacher should carefully consider the approaches of using ICT. They don't have to completely replace and displace traditional techniques, but instead complement them. Next, Maintaining a high level of students' working capacity is possible holding of physical short breaks. The general norm is to conduct a short physical warm-up lasting 1-2 minutes every 20-35 minutes during a lesson, whether or not ICT was used. Next. The ability of the teacher to prevent and neutralize unwanted emotional reactions, resolve conflicts in the student group, attests to her ability to manage the educational process, creating a healthy atmosphere in the classroom. Coordinated interaction. On the picture, you can see interaction among stakeholders. The main responsibility relies on the educational institution authority. Thus, the director oversees the implementation of the relevant rules and regulations, sanitary and ergonomic standards, provides a comprehensive approach to health care support, etc. In part, she can also influence the purchase of quality ICT tools, ergonomic furniture, climate control, and more. Other functions belong to the deputy director, pedagogical staff, teachers and class teachers, students, parents. Thus, we have identified the main organizational and pedagogical conditions of health-saving use of ICT in school. All these conditions can be realized only through coordinated interaction of all stakeholders of the educational process. Each school can determine its way of implementing organizational and pedagogical conditions, depending on the tasks, available resources, staff, etc. We propose some hints and examples based on our experience. For example, to develop a health-saving component of students' digital competence, we provide a training session within a specialized training course, elective. To assure interdisciplinary integration of the health-saving content of different subjects, we provide a thematic seminar presentation for subject teachers. We explain them to a sense of named conditions, and so on. For verification, the efficiency of organizational and pedagogical conditions named above, a range of diagnostic methods were used. To determine the level of attention stability and mental capacity, psychological methodology. To examine vestibular motor reactions, Trinus method. To determine the physico-emotional student state, author's questionnaire. We consider all mentioned to be the important elements of the effective and health-saving educational process. The diagnostic involves the formation of control and experimental group of students, which were formed as follows. Control group included 143 students of 7-9 classes. These students work with ICT on computer science lesson in the usual mode. At the beginning and end of the lesson, diagnostic methods were conducted. Experimental group included 137 students of 7 to 9 classes. For these students, the range of measures previously described was applied at the beginning and at the end of the lesson. Diagnostic methods were conducted as well. Let's go through the main results. Attention stability and mental capacity saw important physical properties and an integral part of overall personal health. So, the task was to analyze their dynamics before and after using ICT, namely a computer. As a diagnostic tool, we have chosen the psychological methodology that made it possible to evaluate the fatigue of the control group and experimental group students before and after working at the computer. Thus, students of experimental group showed higher levels of attention stability and mental capacity and the end ICT computer use than students of control group. Their vestibular apparatus is of great importance for the human mental health. The range of disorders of the vestibular apparatus functions is quite wide. Headache, sleep disorders, disorders of coordination, memory disorders, irritation, etc. The negative reaction of an organism is possible even after short work with the computer in case the ergonomic norms and conditions of its use are not observed. The results testify to the effectiveness of organization the educational process of experimental group students who work according to author's recommendation. The success of the educational process depends largely on the mental state of the student that is an integral part of his or her mental health. The main evidence of maintaining the students' satisfactory conditions is maintaining their interest and enjoyment of the lesson, emotional upliftment, well-being. In this concern, we developed a special questionnaire. The answers to the following questions were described as you can see on the slide. In general, the quantitative indicators of the physico-emotional state of the students obtained via the author's questionnaire provides the results in experimental group to be better than control group. Thus, is modern condition of ICT widespread is necessary to minimize potential risk connected with their implementation. The important task for educators who work with middle school students, teenagers, is to create a safe and health-friendly educational environment. The proposed model and hints of providing of named conditions for health-saving use of ICT much to recommend for the implementation at the school level. Still, the named conditions can be realized only through the concentration of efforts and concentrate interactions of all parties of the educational process. Thank you for your attention.